Good morning, everyone, and welcome back to the public session for today's Oversight and Engagement Board. It is 10:01 and we are live on YouTube. Thank you, everyone, for coming as always. I'll get straight into the agenda. So we'll go to the minutes from the previous meeting, which was held on the 4th of February 2021, just to remind everyone of the year. I presume everyone is happy with those minutes unless anyone has any other reason. So we'll sign them off as a record of the meeting. Thank you very much. So we come to Lucy Whiteman for her weekly surveillance report. Hi, Lucy.
Good morning, everybody, and thank you, Councillor Morris. I'm just going to do a quick summary for those that didn't catch up with last week's publication. This contains data up to the 7th of February. Key headlines: obviously, we continue to be in a national lockdown, and although we are seeing a reduction in the number of cases in Northamptonshire, there still is significant variation across our boroughs and districts, with Corby in particular remaining stubbornly high and seeing some concerning spikes in the 17 to 21-year-old case rate. Again, a similar case rate issue in Kettering with that age group. So still some challenging issues that we need to address, but overall slow but positive progress. In the week up to the 7th of February, we saw 1,839 COVID positive cases, and the lion's share of that transmission continues to be within and between households, despite lockdown actually restricting any movement between households unless you are specifically in a support bubble. If we jump down to the first page of data, as we always do, you can obviously see here that we have got that slow and gradual decline, but you can see obviously just pre-Christmas into the new year, it obviously hasn't echoed the very sharp increase, and therefore that's obviously why it does feel a little bit laboured at this point in time. But as I said, we need to focus on the positive, and that is the fact that we have still had a further reduction in cases. If we go to the next slide, please. So this, as always, shows just the case rate and the difference that I was talking about across our boroughs and districts, ranging from our lower rates in South Northamptonshire, for example, and Daventry in the low 100 rates, all the way up to places like Corby, still stubbornly high at 444.5 cases per 100,000 as a rolling 7-day average. As I said, this data goes up to the 7th of February, and I am pleased to say that we have seen a further reduction on that. But Corby, Northamptonshire and Northampton do remain statistically significantly higher than both the regional and the England average. So still no cause for complacency here, please. If we go on to the next slide. So this is the actual number of cases. As I said, good news that it is a decrease in the actual count, but again, labouring the fact that we do have a slow recovery in some areas. If we go down. Again, we can see the fluctuation in increases and decreases as a percentage change on the previous 7 days here. The good news is that all of the bars that are below the line obviously demonstrate a decrease in our case rate. We had a couple of weeks ago, as people will see, where those bars underneath the line got shorter and shorter and shorter. We saw, a slowing of our progress. I'm really pleased to say again that although slow, we have seen that pick up a little in the last week or two. And again, just imploring people to stick to all of those rules, not to try and bend them. All of the lockdown rules are there for a reason, and we need to make sure that we're in as positive a position as possible to ensure we come out of lockdown. That's all of our boroughs and districts, and that nobody is left behind when Boris obviously produces his plan next week. If we go on, please. Again, this just illustrates the downward trend. We still have got some boroughs and districts that sit not only above our county average, but also the England average rate. So we've still got some work to do to catch up. If we go down. So again, we focused on, making sure that people who are working age and who do have to attend work, we do recognise that in particular there are certain boroughs and districts where this is much more an issue, that people can't work from home. But we do know that that is part of the reason that we're still seeing the lion's share of cases be in the 30 to 39-year-old age group for men and women. They are also people who are likely to still have childcare responsibilities or caring responsibilities for older parents. So we do recognise support bubbles do play a part in this. But just reminding people, obviously, where even if they've got a support bubble, they should only have one for caring responsibilities and potentially one other, if necessary, for childcare responsibilities, and they shouldn't be mixing those bubbles. And particularly over half term, we've been trying to reinforce that messaging, and that even while you're out playing, particularly in the fact the weather's been a little bit milder, is making sure that people still do maintain safe distancing and trying to mitigate any risk when people are having to come into contact with each other. If we go down, please. The good news is that we've seen a decrease in our over 60s case rate, and we know that that correlates with our admissions to hospital. So people can still see that we've got a steady decline, although fluctuations day to day on the number of patients admitted with COVID. We are still seeing a general downward trend, which is really, really good news. If we move on. So this is the number of deaths, and again, the reduction in the over 60s case rate in particular, although we have had deaths in other age groups, it does also obviously translate into a reduced mortality rate. Sadly, there still has been an increase in both Wellingborough and Corby in the week up to the 7th of February. So people, you know, as I said, really can't be complacent, but the overall trend generally is downward, and obviously we want to make sure that we get this back down to zero as soon as possible. If we move on. If we go down to the outbreaks, if that's okay, Cheryl, please. So slightly better news in as much as we are starting to see a slowing of the number of outbreaks. Again, these are still very much focused on care homes and care settings, and that is very much in part due to the fact that we proactively swab both residents and recipients of care, but also the care staff. So we do find these outbreaks much more proactively than in other settings. We're doing more lateral flow device testing, so that asymptomatic testing, as people know, for people who are having to work. We've got now 3 community centres that do that, 2 in Northampton, 1 in Corby, and we've got further planned for the next couple of weeks. We do need to reinforce the fact, though, that when people do have lateral flow tests, even if they get a negative result, they still have to work within the law. We are still in lockdown, they should not be mixing. And it doesn't mean they don't have COVID, it just means that they are not highly contagious at the point at which that test was taken. And similarly, just want to reinforce the fact that vaccinations also, although provide some level of cover, they don't provide it for everybody. We've still got a very, very long programme to roll out, and you don't have as much protection as you would need to feel safe to mix again until we've got that sort of second dose in people's arms. So again, please don't feel that if you get a dose of the vaccination, it also means that you don't have to adhere to the rules and that you should be mixing. You still pose a risk to others, as well as potentially are at risk yourself until you have full antibody response. If I stop there, Councillor Morris, people obviously have got access to the full report online if they need it.
Thank you very much, Lucy, as always. Some encouraging news in those figures, but no complacency can be allowed at this point, and it's still a fairly long haul, probably, really, as our way out of this public health crisis. But thank you very much. So I'm looking around for any questions. I can't see any, in which case, Lucy, can we come back to you to do a testing update, please? Thank you.
Apologies, struggling to unmute myself there. Yes, so testing overall is good news. Clearly, the messaging around the slower recovery and the level of risk that still remains in Northamptonshire is getting through. We have seen what looks like a slight decrease in some of our testing methodologies. So our PCR tests, which is the traditional test for people who don't have, who have symptoms, has gone down slightly, but that's because obviously we're offering now so much more of the asymptomatic testing. So overall testing rates remain really high. The one thing that obviously we are doing is trying to make sure that testing is as accessible to everybody as possible. We rotate our mobile testing units on top of obviously still having a number of semi-permanent testing sites. The other element from a point of view of contact tracing, if I can add that in as well, because it's the follow-up to people getting a positive test, is that we've got really good uptake and reporting levels. We're now up to 90% in Northamptonshire, so 90% of cases and contacts are being followed up. They're getting the information about the fact that they're at risk, and they're obviously getting advice and information about the support they might need while they isolate for their 10-day period. So really good news. We still clearly have room for improvement. We still need to make sure that we reach 100% of those people, but there is still good progress. And I just wanted to say thank you to all the teams who've been supporting that, because with the number of cases that we've seen over the last few weeks, that has been a significant increase in their caseload, and they've continued to be able to follow that higher level number of people up, which is really, really good news.
Thank you very much, Lucy. That's really good news, the 90% rate, given where we were at when it was a more national system. I think that shows a remarkable improvement on the figures. As you say, always good to get a higher figure, but I think that's heading in the right direction. And as I think testing and contact tracing will be very important going forward, we've formed a very good basis there for our testing going forward, whatever form that might take. So brilliant news. Thank you very much for that. I'm looking around. There are no questions, in which case I smoothly bring you on to contact tracing update, which you can now give us an update on. Thank you, Lucy.
So that was, I chucked both in together, I'll be honest. So yeah, so we've got that 90%. People have got some slides and they can see obviously that, as I said, we've still got a little bit of room for improvement. But overall, we are managing to get to a much higher proportion of cases. And indeed, actually, Rutland has the highest contact tracing rate in the East Midlands at 91%, and we're joint second with Leicestershire. So as you've already said, it's a really good achievement, and we continue to strive to improve on that as well.
While it doesn't want to be a competition between counties, it would be very nice to see us at the top of that rate. And we are within 1% of that. So it's highly achievable. Not that I say as it's not a competition. I will bring in Kath now, Kath Hall, to give us a comms update. Catherine, good morning.
Morning. Hi, everyone. Right, okie dokie. Let's go for this. So obviously, we're expecting an announcement from Boris Johnson on Monday about the pathway out of lockdown. We expect that to just be an announcement on Monday with no actual change from that point, but we don't know. But obviously, we will be making preparations for whatever comes out of that meeting or that announcement on Monday. So we've got a lot of work going on with BAME communities, specifically around the vaccine. So this was probably highlighted a couple of months ago, and a lot of work has taken place since that first emerged. So there's a comms and engagement group that now meet 3 times a week and continue to do so. And there's a range of people involved in that now, from clinicians to counsellors, community leaders, faith leaders, and all of those people working together to get messages into communities in the languages that the communities need to access them in. There's webinars taking place in different languages as well. And within the BAME community group as a whole, there are smaller webinars taking place for more targeted groups, so South Asian groups, for example. So that work's going very well. We're really pleased with the engagement that we've had from local communities, counsellors, clinicians alike, and that work continues to carry on. And obviously it's a two-way process with feedback coming back from communities about what else is required. And in addition to that, we've got more social media going out with examples of people from different BAME groups who've had the vaccine, some factual myth-busting messages going out. We're working with Inspiration FM, who are a BAME community radio station, and we're doing a lot more work with translations. And we're also using our iVans, which are the digital vans that go around the county, to target different communities. And one of the benefits really of using those vans is that we can change the messaging depending on the location. So we can go from an area in Northampton with certain messaging in certain languages to an area in Wellingborough with different messaging in different languages. So that's providing us with some good flexibility. It's mentioned already about social distancing. Obviously the weather is improving, which makes people want to go outside more. It's half term. Everybody's been inside for a long time and very fed up. So we're trying to just reinforce the messaging the actual legislation states if you're going to exercise, it's one person with one other person or a household together, but not a household plus a person. So it's just being very clear about that, and to keep socially distanced outside. So if you are going to the parks, just try and avoid areas that are heavily populated or times that are more busy. So we've got some social media going out about that. And we've been working with the police. Skate parks in particular tend to be quite busy at the moment. Just trying to make sure that people use the areas safely and within the guidance. So that's quite a key message this week. We're continuing to do some work, generic work with young people. So there's two sets of work really with young people. One's about just trying to reach them with messages that they understand and they relate to, in addition to trying to understand what's driving the case rates in the 17 to 21-year-old age group, specifically in those areas, Corby and Kettering, where case rates are higher. So trying to really work with our engagement colleagues to understand some insight into what might be driving that. We've done some targeted work in Corby and Kettering, that continues. There's a booklet going out in Corby to all households, and there is a leaflet going out in Corby to hotspot areas to help people understand what the common kind of areas for breaches in legislation are, or transmission risk areas. We've done quite a lot to support lateral flow device testing. So our third community testing centre launched this week at Danes Camp Leisure Centre. So this is where key workers, people who are in manufacturing, distribution, warehouse kind of employment, healthcare workers that wouldn't have access to LFD testing in their workplaces, are encouraged to go and get testing. It's for people without symptoms to detect whether they've got a high viral load of the virus, and anyone who tests positive can then isolate and keep everyone else safe. So there's more of those coming on board soon, but we're supporting that, and we've got social media going on that as well. Just with relation to that, we're doing a podcast called Northampton Now. The next one that comes out will be about business grants, and the third one, which will follow shortly after, is also about LFD testing. So we'll be really looking to try and share them with our business communities. We're continuing to work with our ambassadors and link in with the work that they are involved in as well. And next week, we've got a focus group for people with learning disabilities to make sure that we are getting messages to that community in a method that is accessible and understandable to them as well. It's probably the summary from me.
Thank you very much, Kath, as always, and very interesting to hear the work that's going on and has been going on, certainly within the BAME and minority communities within Northamptonshire. So very good to see that. And thank you for all your hard work, as always, with the ever-changing landscape that we seem to see, particularly with next week, with this announcement from Boris Johnson on the way out of lockdown. I suspect you'll have to be fleet of foot as always, which I'm sure you will be, to start to change the messaging as and when that's needed. So thank you very much for that. I would remind everyone about the press conference tomorrow afternoon as well at 3 o'clock. Sadly, I won't be hosting that this week as I've got a prior commitment, but Jonathan Nunn has kindly offered to step in to chair that tomorrow. So all tune in. I'm sure he'll do an amazing job, and hopefully we'll answer we'll get all the questions answered as always. He'll do a grand job. I think that's it from me, unless, Lucy, did you want to add anything at the end?
I'm struggling with buttons this morning. No, nothing else from me, but thank you everybody obviously for joining us as always. I think it's really exciting. We've got something to look forward to next week, which is, you know, the outline of how we start to progress back to normality. But again, we can't be clearer about the fact that we've got to make sure that we've got a level playing field so that everybody, you know, it has the opportunity to come out at the same time.
Yes, absolutely. And we will work as hard as we can to make sure that happens, I'm sure. So the next meeting for this group is on the 4th of March. That seems like a long way away, but it isn't. We'll be in March very shortly. So thank you everyone for coming today. and thank you for the reports and the questions and answers. Thank you. I will see you next week. We do have the all councillors briefing on the Thursday, which I would recommend to any councillors on the line, and please do trail it with all your colleagues, councillor colleagues. Thank you very much. Have a good day.